Hello everyone, today's video covers 30 important questions asked previously. So what is infantile type of body proportion and where is it seen? It's seen in achondroplasia. Okay, infantile type means upper segment is longer than lower segment in infants and length is more than the arm span. Now this is seen in achondroplasia and in cretinism. This is a picture of achondroplasia. Here you can see the proximal bones are short. Okay, the humerus, the femur, proximal bones are short. This is the typical example of infantile type of body proportion. Infant of diabetic mother, the most common congenital heart disease in IDM babies is transposition of great arteries. TGA is the most common congenital heart disease in IDM. Congestive cardiac failure, that is CCF, is the most common complication and most common cause of death in untreated PDA. Shone complex, like you can see here, the left side of the heart is involved. There is supravalvular mitral membrane or ring. There is parachute mitral valve. There is subaortic stenosis and coarctation of aorta. These are the components of Shone complex and it involves the left side of the heart. Feeble femoral pulses compared to strong brachial pulses. This suggests the diagnosis of coarctation of aorta. Also, there will be increased blood pressure in the upper limbs as compared to the lower limbs. This should point towards the diagnosis of coarctation of aorta. Most common valve that's involved in acute rheumatic fever is the mitral valve and most common pathology is mitral regurgitation, MR. Antibodies used most commonly for serological testing in rheumatic fever. Remember ASO titer. Okay, ASO titers are commonly used for serological testing. The others are anti-DNase and anti-hyaluronidase. These are the manifestations, the pictures you are seeing here. These are seen in infective endocarditis. Okay, Roth spots, as you can see, white centered retinal hemorrhages, and other lesions seen in infective endocarditis are splinter hemorrhages here in the nails, Janeway lesions and Osler nodes. Most common cause of infective endocarditis in prosthetic valve is cons. Coagulase negative Staphylococcus aureus. This is in prosthetic valves. Most common cause of CRU or acute laryngotracheobronchitis. Most common cause is the para-influenza virus type 1 and the other causes are RSV, influenza, adenovirus and rhinovirus. The most consistent clinical manifestation of pneumonia is tachypnea. Most common cause of ASOM is Streptococcus pneumoniae, which is nearly 40% of cases, H. influenzae, which is nearly 25% of cases, and Moraxella catarrhalis. Okay, these are the most common causes of acute suppurative otitis media. Most common posterior mediastinal mass in children. Okay, these are tumors of neurogenic origin, and the most common tumor is neuroblastoma. The others are foregut cysts and lymphomas. Okay, but the most common posterior mediastinal mass is neuroblastoma. Cobblestone appearance is typically seen in Crohn's disease. Like you can see here, there are crypts between the inflamed mucosa. This is typically seen in Crohn's disease, cobblestone appearance. Backwash ileitis is a feature of ulcerative colitis. Most common cause of portal hypertension in children is pre-sinusoidal or extrahepatic causes, and usually it is because of portal vein obstruction. Okay, extrahepatic portal vein obstruction. Most common cause of diarrheal disease in infants is rotavirus. The Finnish type of congenital nephrotic syndrome, there is a gene mutation affecting the nephrin protein. The Finnish type of congenital nephrotic syndrome, there is a genetic mutation of nephrin protein. Best response to steroids is observed in minimal change disease nephrotic syndrome. Lysencephaly is also called as agyria. Like you can see over here, the cerebrum, the cerebral hemispheres, there are no convolutions that should be there ideally. Okay, so lysencephaly is also called as agyria, smooth brain basically. Schizencephaly is basically unilateral or bilateral clefts within the cerebral hemisphere, like you can see over here. Okay, schizencephaly has clefts within the cerebral hemisphere. Type 1 glycogen storage disorder, the deficiency is glucose 6 phosphatase deficiency, and type 2 Pompe disease, the deficiency is lysosomal acid alpha glucosidase deficiency. Hereditary fructose intolerance, there's deficiency of the enzyme aldolase B. Tomcat urine odor, deficiency of multiple carboxylase enzyme. Boiled cabbage, smell of urine is seen in tyrosinemia and hypermethionemia. The clinical triad of hypotonia, head lag, and macrocephaly is seen in Canavan disease. Abnormal gene for Wilson disease is on the long arm of chromosome 13. Long arm of chromosome 13. Characteristic calcification along the outline of cortex of both adrenal glands is seen in Wolman disease. Here you can see the calcification along the outline of the adrenal glands, and this is seen in Wolman disease, and this is due to acid lipase enzyme deficiency. That's all for today. Stay tuned for more videos.